So today I'm going to be talking about a stroke and the effects from it. So what is a stroke? A stroke is basically a medical emergency that occurs where blood supply to the brain is suddenly interrupted. A stroke can also be caused by a blood vessel suddenly bursting in the brain, which causes blood to spill into the spaces surrounding the brain cells. And then when this happens, the brain can't get enough oxygen, and as a result, the brain cells start to die. So, main cause of a stroke is hypertension, high blood pressure, but there's other causes too, such as diabetes, smoking, ischemia, hemorrhage, high cholesterol, and so many more reasons too. So, signs of a stroke include trouble speaking, sudden confusion, not being able to see out of both their eyes, trouble walking, loss of balance, usually numbness on one side of the body, especially in like the face, legs, arm. So if you ever see someone suffering from a stroke, you can use the FAST acronym, which is basically F is for face. You want to ask the person to smile, and if one side of their face is kind of like drooped down, that's a sign of stroke. A for arms, you ask the person to raise both their arms. If one of their arms is kind of droops down or they can't lift it in general, that's another sign of a stroke. S, speech, you ask the person to repeat a sentence after you, and if their speech sounds a little slurred and unnormal from how they usually talk, that's another sign as well. And then time, if any of these signs are prevalent, you want to call 911 immediately. So who is affected? So the risk of stroke increases within age. For adults between 35 to 44, the incidence of a stroke is about 30 to 120 of 100,000 people per year. And then for adults 65 to 74, the incidence of a stroke is 670 to 970 of 100,000 people per year. So it significantly increases within age. Strokes that occur among children are very rare, but they can still happen. It's about 1 to 3 of 100,000 children per year. So people with Asian, Latin American, and African origin have a higher chance of getting a stroke than people with European origin. And in this chart, it basically just explains what I just said. People of African American origin have a higher risk of stroke, and this just shows the men and women of different descents that are more at risk. And then I put a little link at the bottom here just to look at the chart more closely. And then these are just two maps showing basically how the highest risk, or what part of the region in the United States have the highest risk of stroke. So as you can see, the southeast region has the highest incidence of stroke. So for the map to its left, it shows the ages 35 and up. And in this little bottom right corner, it shows the annual average rate of strokes per year in that region. And then in this map, it shows ages 65 and up. And you can see in this, the incidence, it has majorly increased compared to ages 35 and up. So that just goes to show how much a stroke can increase with an age. So how can a stroke affect the exercise response? So patients that suffer from a stroke usually have mobility issues. Some of these issues include hemiplegia, which is paralysis on one side of the body, like I was talking earlier about. Hemiparesis, which is weakness on one side of the body. Apraxia, difficulty moving the legs or planning leg movements, which could definitely make it difficult for someone exercising. ataxia, difficulty coordinating movements, making someone feel a little slow, clumsy. Hypertonia, which is high tone, causing the muscles to stiffen. And then there's hypotonia, which is low tone, causing the muscles to loosen. So how can exercise affect a stroke? So exercise is shown to decrease high blood pressure and high cholesterol, which are the two biggest risk factors for a stroke. And since stroke patients have a loss of mobility, exercise rehabilitation can improve that through using strength training, resistance exercises, aerobic, and flexibility exercises as well. Exercise also greatly improves a patient's cardiovascular fitness and walking capacity. The only negative effects of exercise would be to not do any heavy, vigorous exercises or lifting, because if you do that, the likelihood of a stroke could occur again. So you want to keep all your exercises low to moderate intensity. So pharmaceutical indications, usually patients suffering from a stroke will be on either one or more of these medications, including ACE inhibitors, blocking the conversion of angiotensin 1 and 2 from narrowing the blood vessels. Beta blockers reduce the heart rate response and reduce blood pressure. Thiazide diuretics reduce blood volume. Calcium channel blockers blocks the voltage-gated calcium channels, which allows the blood vessels to relax and open. And then alpha blockers, which prevent norepinephrine from tightening the muscle walls of small arteries and veins. So for my case study, we're looking at a 50-year-old male who just recovered from a minor stroke. His blood pressure is 136/81, putting him at hypertension stage 1. Before his stroke, he worked out 3 days a week, but since recovering from a stroke, he's living a sedentary lifestyle. He has a BMI of 26, and he's currently taking beta blockers and thiazide diuretics. So what would you include in the conversation? You would ask the following questions, such as, what is your medical history? Are you cleared by a physician? How long has it been since you had a stroke? How has suffering from stroke affected your daily life? Do you exercise regularly? Do you have access to a gym? Would you be willing to participate in an exercise program? And if so, how often? What's your diet like? What are the medications that you're taking? How do they affect your daily life? And then I would have a conversation with him basically about the risk to benefit ratio and how exercise can improve his life since suffering from a stroke. So exercise testing, you would want to do all these exercise tests at a low to moderate intensity. So submaximal treadmill tests to assess cardiovascular endurance, the 6-minute walk test to assess exercise tolerance and capacity, submaximal cycle ergometer tests to measure the patient's cardiovascular fitness, flexibility tests to assess flexibility in the joints and muscles, hand dynamometer tests to assess the patient's hand grip strength. And you would also want to take the patient's blood pressure during exercise testing to avoid post-exercise hypotension. And you would want to monitor their RPE as well, since this patient is on beta blockers. The beta blockers will reduce submax and max exercise capacity. So exercise prescription. You would want to do a frequency about 2 to 3 days per week of light strength training to help build muscle, 5 to 7 days per week of aerobic exercises. You can do 3 to 5 days per week starting it out, but you want to gradually increase to 5 to 7 days per week. Basically, aerobic exercises are recommended just because they're low intensity and they can be sustained over a long period of time. And then you want to do 2 to 3 days per week of flexibility and balance training exercises. to help improve the client's overall function, reduce joint stiffness, and reduce the risk of falling. So for intensity, you want to do low to moderate intensity using a light load for strength training, 12 to 15 reps and 2 to 3 sets using 67% of 1RM. And the patient should do about 8 to 10 exercises involving different muscle groups. And they should do a rest period about between 20 to 30 seconds between each set for strength training. Aerobic exercises, you should do 40 to 70% of peak oxygen uptake and 50 to 80% of maximal heart rate. For flexibility, you want to hold each stretch for about 10 to 20 seconds, repeat 3 to 4 times, and obviously stretch to a point of slight tension but not any pain. For time, you want to do 10 to 20 minutes of flexibility and balance training after aerobic and strength training exercises, basically to help improve muscle coordination and warm up the muscles. And then you want to do 20 to 30 minutes of strength training and aerobic exercises, or you can do 10-minute sessions throughout the day as long as the patient meets the required amount of exercise. And then the type of exercises, so there's strength training. This can be done either on the machine or using the body weight while being assisted. This could be a sit-to-stand exercise, mini squats, lunges. They could crumble a piece of paper, lift a cup for bicep curls, plank with the knees on the ground, mini push-up with the knees on the ground, standing knee raises while holding on to something, and they can also do wrist curls with a water bottle. And then flexibility training, you could do inner arm stretch, wrist and hand stretch, elbow stretch, hip openers, wrist curls, hip abduction, hip flexion with a hold, hip external and internal rotation, and so many more. You could do balance training such as assisted knee raises, assisted reverse leg swings, and then aerobic exercises such as walking on a treadmill, stationary bike, swimming, and assisted box step up. So for the modifications and precautions, depending on what medication a stroke patient is on will affect the exercise response. So for the case study, this patient was on beta blockers and thiazide diuretics. For the beta blockers, it affects the exercise response by attenuating the heart rate response to exercise and it increase or decrease maximal exercise capacity. This beta blockers can also cause shortness of breath, so it's important to not allowing the patient to perform heavy lifting or vigorous exercises just because they can get out of breath easily, cause them to faint. Thiazide diuretics affect the exercise response by excreting more sodium into the urine, which causes the patient to become more dehydrated. So you want to make sure the patient is getting enough fluids during exercising. And then you could also, some precautions or modifications could be putting up handrails or even using a harness for exercise equipment to help modify to the patient's needs, because they do have trouble with their legs and mobility movements in general, so this will help them out. Like I said before, exercises can be done in 10-minute intervals as long as the patient gets the recommended exercise goal for the day. And again, since the BMI of our patient is 26 or 27, I believe, that puts them at overweight, and you do not want them to be doing any rigorous heavy lifting exercises. You want to keep it low to moderate intensity so that it does not lead to an increase in blood pressure. And there are my references.